Today we welcome in interventional cardiologist Dr. Chris Rogers, who's at Bronson Advanced Cardiac. Dr. Rogers, good morning.
Good morning.
How are you?
I'm doing very well. How are you?
I am doing fine. We were joking earlier that because I was in the Army and I had to take medical terminology that I know what aortic stenosis means, and they're looking at me going, well, at least you could pronounce it right. And I'm like, well, I'm sure Dr. Rogers will enlighten us, so be quiet.
Sure. Aortic stenosis is a slowly progressive disease involving the aortic valve. The aortic valve is the last valve your heart pumps all the oxygenated blood out to your body through. Aortic stenosis is a progressive thickening of the leaflets of the valve so that the leaflets become more and more immobile, creating strain for your heart to do its job. And basically people start to develop symptoms or once they start to develop symptoms of aortic valve disease, then mortality, the likelihood that they will pass away, becomes quite high. Symptoms usually are chest discomfort of some kind, either heaviness, pressure, tightness, or undue shortness of breath with activity, progressive fatigability, lightheadedness or dizziness, or actually fainting spells. Those are usually the symptoms that we worry about with people with aortic valve disease. And if we don't do something mechanically to fix that problem, we really can't affect or impact their mortality. And mortality is high. It's at least a 50% mortality at 1 year, 68% mortality at 2 years, and by 5 years, 97% of the people who have this disease process don't survive.
Dr. Rogers, is this a congenital disease? Is this something that can be inherited, or is this something that's acquired because of lifestyle or diet or things or medical conditions that pre-exist?
Usually, well, it can be all of the above, pretty much. There are some forms of aortic stenosis that are congenital. People can be born with a bicuspid or unicuspid aortic valve. Instead of having 3 leaflets, they have either 2 or 1. People with a unicuspid valve don't do very well. They don't live very long. People with a bicuspid valve usually live fine, but they develop symptoms of valvular disease earlier in life, probably in their 50s to 60s. The type of valve disease that we're talking about, not because it's trying to be mean, but it's usually called senile aortic valve stenosis because it occurs in people after we age, usually in their 8th, 9th decades of life, so 70s, 80s is when people start to truly develop this process. And mostly there is some suggestion that cholesterol imbalance can create or add to the problem, but in general it's usually just a degenerative process that occurs over time. You know, your valve's been working for many years and it just is getting a little bit worn out. And then there are some people who are affected by rheumatic heart disease, and rheumatic heart disease it's an infection, a strep infection that affects your heart, and that can cause problems as well for both the mitral and the aortic valve, and that can also lead to aortic valve stenosis. So it's kind of a multitude of different things that can cause the problem.
Dr. Chris Rogers with us. He's an interventional cardiologist at Bronson Advanced Cardiac. So we talked a little bit about what it is and what the symptoms are. What are the options for treatment with aortic stenosis?
Well, standard therapy, or the most tried and true therapy, is still surgical aortic valve replacement. You see a heart surgeon and he replaces your aortic valve with either a metallic valve or a mechanical valve or a tissue valve. In 2012, the U.S. government approved the first device that could be done differently, a transcatheter aortic valve replacement, which is a device that can be placed in high-risk patients who had no surgical option because their likelihood of survival of a surgery was poor. This offered us an opportunity to affect and change their lives. And so we have 4 different mechanisms which we can insert this valve through. One is through the groin at the hip area, the femoral artery. A little higher than that up in the pelvis area in the iliac artery, or we can make a direct puncture right into the apex of the point of the heart and implant the valve through the point of the heart, or a small mini incision up on either in the sternum or the breastbone, or right off to the right-hand side of the sternum and go directly through the aorta across the valve and implant this heart, or actually go across their valve and implant this heart valve. And so that's really been quite a big game changer since the development of these implantable devices. And now there is a second type of valve that's also been approved, the core valve. So the first was the SAPIEN valve, and now we have the core valve. So we have two different opportunities.
Dr. Rogers, how many procedures to alleviate aortic stenosis have you done, and which one do you prefer?
Yes, we've done 43 procedures here, and I find each of the techniques that we have available are unique, and it's exciting to do all four of them. I think I prefer the femoral the best because I'm the most involved in that, but it's a big team. We work with cardiac surgeons, interventional cardiology. It's a big crew of people, cardiovascular anesthesiologists. So it's a lot of manpower, not just from a physician standpoint, but also nursing and all hospital employees. So it's been a very rewarding process.
Dr. Rogers, before we let you go, obviously talking to your primary care doctor is where you probably need to start. But if people want more information about aortic stenosis, is there a place they can go?
They can Google. I know that they can Google Edwards Life Sciences, and they should be able to find something regarding aortic valve stenosis on their website. And then they can always contact our office. We'll be able are glad to provide them with any information that they would like to have about aortic valve disease.
Dr. Chris Rogers is an interventional cardiologist at Bronson Advanced Cardiac Healthcare. We're talking about aortic stenosis on our Bronson MedChat. Dr. Rogers, thank you for taking time out of your busy day. We appreciate you talking with us, and we'll look forward to speaking with you again sometime.
Thank you, Jim. Have a good day.
Thank you. You too. Dr. Chris Rogers at Bronson Advanced Cardiac.